Welcome to the latest printed press. I'm Aysen Djemal, and yet again, we are on your screens talking about the latest on COVID-19. This is going to be a very informative program, and I'm very pleased to have Sibel Ihsan, who is the lead Directorate Pharmacist in Waltham Forest. Welcome, Sibel, to the program. Again, thank you very much for coming on.
Thank you, Aysen. Thank you for having me.
Oh, it's an absolute pleasure as always. We've got Didem Sevinç, who is the Hackney Vaccine Ambassador. Welcome, Didem, to the program.
Hello, thank you for having me.
Oh, it's an absolute pleasure. Thank you very much for joining us. We've got Devrim Yesil, who is the Vaccine Ambassador. Devrim, welcome to our program. Thank you very much. Hoş geldiniz programımıza. Nasılsınız?
Bulduk.
Memnun olduk. Biz de çok memnun olduk. We've got Dr. Mekella Mehmet Yesil, who is the Public Health Researcher and Haringey Vaccine Ambassador. As always, it's a real pleasure to see you, Mekella, on my program again. Thank you very much.
Thanks for having me, Aysen. Thank you. Nice to see you all.
Yeah, it's very nice to see you all. And last but definitely not least, we've got Gulay Ermiya, who is the Digital Health Officer, Occupational Psychologist. Welcome, Gulay, to the front of the screens instead of the back of the screens.
It's good to be here. Thank you for having me.
Yeah, it is. It is. It's really nice to see you and for you to, share your specialism with us tonight on this very important program. Like I said at the beginning of the program, very, very informative, the latest on COVID-19, community and health. So, moving on to our first question, recent news publications claim that Britain could be the first country out of the pandemic. However, we have currently seen an increase of daily death rates in the UK rates. And I'm going to ask my first question to Dr. Mekella. Could you tell us more about the latest statistics in the UK and what this actually means?
Right. In relation to where we are compared to this time last year, we're actually in a much, much better place. Obviously, the figures are going down in relation to deaths and transmission. The infection rates are a lot higher, but that's only because we've removed the restrictions. So people are socialising more, they're going out, they're meeting people, they're going back to work, the office, using public transport and stuff like that. So in relation to where we are with statistics, the death rate is going down, but the infection rates are going up. But that's because we've also vaccinated a lot of people. So we've done a good job of sort of like relating to people to get vaccinated. And in relation to where we are globally, we're actually the fourth best country. UK come fourth in relation to vaccinating, which means that 90.5% of our population had the first vaccine, 83.1% have had the second vaccine, and 62.7% have had their booster, which is really, really good. In daily figures, that corresponds to about 19,520 vaccines per day first, 30,340 for second dose, and 126,632 for their third dose. So in comparison with other countries, we're doing really well. I wouldn't say we're coming to the end of the pandemic, but I can see the light at the end of the tunnel much clearer this year than we did in 2020 and 2021.
Oh, that's really good news. My second question is towards you as well, Mekella. How dangerous is this new COVID variant? Because people are quite concerned about that. And where has it spread? The flurona is found in Israel. Should we be worried about this?
Right, this is a new emerging data that we don't know much about at the moment. As far as we're aware, on the Public Health and the World Health Organization, we've only had one incidence at the moment, and that was an unvaccinated pregnant woman in Israel who contracted coronavirus and then a few weeks later developed the flu. So what they've done is they've labelled it corona flu or flu corona, whatever you want to call it. I wouldn't say it's anything to worry about at the moment. I've had discussions with my senior public health team, and they're saying there's nothing on the UK to sort of like bring alarm or raise awareness for anything at the moment. And obviously, because we're vaccinating more people, it's becoming less transmissible. So although people are testing positive, people aren't actually being admitted into hospital with severities or fatalities, thank goodness. So yeah, that's where we are with that. So I wouldn't say it's anything to worry about at the moment. I think it's just a new name. It's been labelled flurona because they're saying it's flu and coronavirus together.
Oh, I see, Florona. Yeah, because I was wondering why it was called
Yeah,
that actually.
corona.
But
So
yes, now that
yeah,
you've explained it, very clever. All these latest names and variants and combinations. Because I know even with the previous variant, it was very much like a cold-like symptoms. But in a sense, the symptoms are less severe. Yes, it's more easy to catch, I guess, but like you said, the fatalities are less. So that's all good news.
Exactly that.
So, yeah, we're going towards the right direction. Obviously, leading from everything that you've said, Sibel is going to say this in English, and then Devrim is going to say it in Turkish. Sibel, why is it important that we take the vaccine and get our boosters? Let's put the message out there. Why is it so
Yeah.
important?
So firstly, like we already know that catching COVID can be serious and it can lead to long-term complications. And we have the real life data which shows us this. And we also know that these complications are more common in older people or those with underlying clinical risk factors. So we can't reliably predict who can have the mild form of the disease or who will end up with the severe form, because somebody could potentially end up having long-term health conditions after being infected, even if they didn't present with any symptoms. And another point to note is that you are able to catch COVID without having any symptoms and then be able to pass it on to family, friends, or even patients who may be at increased risk from the virus or who might not be eligible for vaccination and are at increased risk of severe illness. So being healthy doesn't reduce your risk of catching the virus or passing it onto others, essentially. And the second point that I wanted to make is that with such high COVID numbers at the moment, and what we're seeing in the UK currently, it's even more important to help stop the spread of the virus, to avoid pressure on the NHS and to help keep our health and social care workforce healthy. Because if you are a frontline worker, you are more likely to be exposed to the virus at work, especially healthcare workers and those working in the social care sectors, for example, in care homes, because they will obviously be at much higher risk of repeated exposure to the infection. And I guess as a pharmacist, I can tell you that like all medicines, no vaccine is going to be completely effective. And it does take a few weeks for your body to build up that level of protection from the vaccine. And some people may still get COVID despite having a vaccination, but this should lessen the severity of the infection. And I guess that's what we're most concerned about. With regards to the boosters and us reinforcing our levels of immunization, we have seen studies in the UK that show that there is a major increase in the levels of protection after the booster dose against both symptomatic disease and also hospitalization due to the Delta variant. And early vaccine data from Omicron confirms that protection against symptomatic disease soon after having your booster, so Moderna or Pfizer, specifically the mRNA booster, it increases to around 70 to 75%, regardless of what vaccine you had as your first or second dose. So I guess simply the message is encourage people to have their first and second dose as well as their booster, because that's what the data is currently showing us.
Yeah, thank you very much for that, Sibel. I agree with you. I mean, I've had both my vaccines and my booster, and the booster I did feel quite ill with the booster for about a day, but I think it was definitely worth it. We were going to ask Devrim Hanım the next question, but that's fine. She's going to log on again, and we're going to have that same question answered in Turkish. But in the meantime, I'm going to move on to our fourth question, which is actually towards Didem. The TCCA has upcoming vaccine events. Could you tell us a little bit more about it?
So we have an event that's going to be happening. Sorry, it's going to be based at TCA, but we haven't confirmed the date yet, so it will be let out on our Instagram and Facebook page later, probably next week. But we're planning to do two events, one at TCA and one at a mosque, and there will be other ones at pharmacies. But it's just about so at the moment we're just trying to confirm the dates and have the advertising ready and have it all essential and ready for the public.
Brilliant.
And that will be, so once it is confirmed, it will be let out on our Instagram and Facebook again, and then everyone will be able to sign up and come in for their vaccinations or booster.
Excellent, excellent. So look out on the website is what you're saying.
Yeah.
And we're going to be providing that service. I mean, the TCCA have been absolutely brilliant for our community anyway, and all the initiatives that they have put for us as a community so that we can stay healthy and as safe as possible. Gulay, the TCCA are running digital health support services run by yourself. As the digital health officer, could you tell us a little bit more about this?
So during my role as a digital health officer, I've been taking on several tasks over the last couple of months. My role basically entails supporting the community with digital health support services. For example, I can tell you a little bit about the few things that I've been running. So on a Monday morning, we've been holding a digital support coffee mornings for the elderly to help them gain access to digital information and make bookings. This is very important, especially for those elderly members who speak Turkish and who struggle with information that's only available in English. We recently held also a seminar to teach the Turkish-speaking elderly how to use the NHS app, because obviously it's in English and they struggle to use digital services anyway. So we created this seminar and workshop to teach them step-by-step how to use the NHS app. So I've also been keeping up with the latest government restrictions and providing regular daily updates, both in English and in Turkish, to the community on the TCCA social media pages. I've also been distributing digital health information online using the Haringey hashtag. So during these Haringey Facts hashtags, I covered different topics such as mental health, high blood pressure, COVID-19 and testing and vaccinations, and many more health topics which affect the Turkish-speaking community. Also, my work has surrounded a lot of around promoting the support of the uptake of the vaccine as well as the booster program. And I've done this through digital means such as preparing posters, short video clips, through programming, through social media posts. I've also designed polls to try to get the community engaged. I've also answered phone calls and distribute information on the WhatsApp forums. I've also attended different events and attended training sessions as well. So basically, my role is really based around the digital avenue and just providing support, especially for the elderly and the Turkish-speaking community. We also created a video about the booster program, and if we have a little bit of time, I'd like to show that right now to our audience.
Yeah, that'll be great. Yeah, we can do that.
%73% of our community have received their first dose of the COVID vaccine, and 67% have received their second. Moving forward, we still need to protect our communities and loved ones. So if you are 50 and over and eligible for the COVID booster, please attend your appointment or book online.
The coronavirus is going to be around with us for many years to come, so it's really important that we protect one another.
Over a year and a half, we have seen so many lives lost within the Turkish community. Getting vaccinated saves not only your lives, but many others.
Advances in the vaccine rollout make it possible for everybody to get protected and everyone to get vaccinated. Don't hesitate, get vaccinated, get protected.
We understand that you may have some concerns about the vaccine or require further information in order that you can make an informed decision about the vaccination process. If so, TCCA has 2 vaccination ambassadors and a number of vaccine champions. If you wish to contact us, then please do on our phone number, which is shown below.
You can book the vaccine or booster at your GP or local pharmacy. Alternatively, you will receive a text from 8450 with a link to book your booster. You can additionally find out more through the NHS website, www.nhs.uk.
If you're in full-time education and are between the ages of 12 to 15, you can get vaccinated too. I was vaccinated and I recommend it for everybody.
Aşı sizi ve çevrenizi ve toplumu hastalıktan korur. Yaşamınızın normale dönmesini kolaylaştırır. Aşı yapılmadığı zaman farkında olmadan üzerinizdeki virüsü ailenize, çevrenize ve topluma, sevdiklerinize bulaştırabilirsiniz. Aşı bütün bunları koruyabiliyor, riski azaltabiliyor. Aşı olmak hepimizin görevidir.
Brilliant, very, information advert really, because it's not just an advert, it's actually providing our community with a lot of information. And Devrim Hanım, hoş geldiniz gene. Ben soruma hemen geçeyim sizin için. 3. doz aşılama neden yapılması gerekiyor? Neden yapmalıyız?
Güçlendirici aşı dediğimiz 3. doz aşı neden önemlidir? Çünkü aşı yaptıktan 3 ay sonra vücuttaki antikor seviyesi düşmektedir. İngiltere'de yapılan 3. doz aşı ile ilgili ilk çalışmalar İngiltere'de yapıldı ve 3. doz aşı, hatırlatıcı aşı dediğimiz 3. doz aşının antikor seviyesini yükselttiği, %93'ten fazla koruma sağladığı bilinmektedir. Ayrıca bu 3. doz dediğimiz hatırlatıcı aşıların omikron varyantında da aynı zamanda ölüm ve ağır hastalık riskini azalttığı bilinmektedir. Covid böyle ağır şiddette devam ettikçe ve yeni varyantlar ortaya çıktıkça hatırlatıcı dediğimiz bu doz aşılar tekrar yapılması gerekebilecektir bence.
Evet, aynen. Çok sağ olunuz bilginiz için. Halk Evi'nin ve Toplum Merkez'in aşılama hakkında yaptıkları ortak çalışmaları bizlere anlatabilir misiniz lütfen?
Evet. Yani biz daha önce de Covid ile ilgili aşı çalışmalarında kurum olarak yer aldık. Şimdi de Kıbrıs Türk Toplum Merkezi ile ortak yürüttüğümüz 3. doz aşı için çalışmalar yürütüyoruz. Bu nedenle bastırılan lifletler var. Bunları gerek üyelerimize, gerekse sokaktaki Türk toplumundan, Türk ve Kürt toplumundan ulaşabildiğimiz insanlara veriyoruz. Aynı zamanda derneğimize gelmeyen insanlara telefonla ulaşarak aşıları hakkındaki son durumu, yapıp yapmadıkları ya da booking yapmakta zorlanıp zorlanmadıkları konusunda konuşuyoruz. Gelen üyelere bookingle ilgili yardımcı oluyoruz. Randevu almadan gidebilecekleri aşı merkezlerine yönlendiriyoruz. Onun dışında Kıbrıs Türk Toplum Merkezi ile beraber diğer Türk ve Kürt community center'ları gezerek onlardan da daha çok insana ulaşabilmek için onlarla da görüşmeyi planlıyoruz.
Çok güzel, bayağı çok güzel çalışmalar toplumumuz için. Çok sağ olunuz bu bilgi için. Dediğim gibi İngilizce'de şu anlattık. TCCA Toplum Merkezi'nin web sitesine bakarsanız bu bilgiler ne zaman olacak, bu olaylar bilgi de alabilirsiniz. Öyle mi?
Evet.
Aynen. Tamam. Çok sağ olunuz. Şimdi gene İngilizce. I'm going to go into English again because my next question is both to Mekella and Sibel. So I'll start with Mekella. Could you tell us a bit more about the claims of another new variant? A lot of people in our community are worried about this new variant called Deltacron found in Cyprus. Is it real? Is it a result of a lab contamination? Is there a need to be worried? We'll ask this to Mekella first and then Sibel can follow on.
I think we can answer that jointly between myself and Sibel anyway. We had a conversation about this not long ago. At the moment, we don't know. I think it's just something that's just been contaminated in a lab in Cyprus, and it's just put out there to scaremonger people. There isn't any evidence here in the UK. We haven't heard anything on the Public Health or World Health Organization site, so there's not much to speculate about at the moment. I think Sibel will join me on this one, won't you, Sibel?
Yeah, exactly. So Yeah, exactly, Mekella. So as you've said, I think the new strain was identified in Cyprus, wasn't it? But the World Health Organization haven't actually acknowledged this variant. And there's no data as to whether it's more transmissible than any previous strains of COVID. I think there's been a total of around 25 cases, and all cases so far have been mild or reported as mild. And they've been linked to Deltacron, which is essentially Delta and Omicron combination of two existing strains, but we don't actually know anything more than this. But I don't think it's anything to worry about at this moment.
Absolutely, yeah.
That's fantastic. That's really good because, yeah, you know, all these scaremongering stories, people are worried. People are, because like we were saying off stage, Mekella was saying, I mean, how many years now have we had?
We're in the third year.
Yeah, so I mean, you know, we want to hear some good news, and I think that is what this program is about tonight, is to deliver that good news in a factual way, though, that, you know, we are coming out of this pandemic, hopefully. Gulay, trained in occupational psychology, what are your thoughts on the psychological and occupational impact of COVID-19?
Is that question to me?
Yes.
Sorry, there was just a bit of a disconnect.
That's okay.
So basically, so obviously I've trained in occupational psychology, and I believe this is a very important topic to discuss as it's quite overlooked. Physical health, it has always been the forefront of research and news headlines, but mental health in particular, workplace wellbeing is not really spoken about. So governments have had financial support for workers and businesses to some extent, but there is a lack of emotional interventions. So when we look at COVID-19 pandemic as a whole, there has been a great emergency around the world for the first time in a long time. The pandemic has changed how individuals live and work, and in particular, frontline healthcare professionals have been exposed to alarming levels of stress. We can see this in trends through research, which has been conducted with staff working in the NHS. For example, with NHS surgeons, it has been found that there are emotional and psychological effects of the COVID-19 pandemic on surgeons' mental health in particular, with them showing high levels of fear and anxiety and loss of motivation, low mood, stress and burnout. So there is an urgent need for workplace support and mental health interventions to help surgeons, not just surgeons, but all occupations, in particular NHS workers, to cope with the difficulties that they are facing during the ongoing COVID-19 pandemic. So like I said, it's not just for NHS staff members, it's for other occupations too. So like in the first wave of the pandemic and the second wave of the pandemic, it affected workers who could not work from home. So those who are in office-based jobs would find it easier to work at home compared to those who are like construction workers, restaurant workers who could not work. And it's not something that's always spoken about. There are companies who could not follow their staff members, those who lost their jobs. This is quite a common trend in lower paying jobs or those who had part-time jobs. So with the way the system works, it does not always incorporate these issues. So there is a great need for further research to look at the long-term effects of the pandemic and how that has impacted occupational health, the way the workforce is evolving, the way the workplace makes decisions, and how they take into consideration the safety and well-being of their employees. So how do we prevent this? What can employers do moving forward? So firstly, they could support the mental health of employees who are continuing to work in essential and key worker roles. Many of them who have spent months working under significantly increased pressure that make them more vulnerable to stress or other mental health conditions. Secondly, the need to support those who continue to work from home as well as those who continue to work from the workplace. So the resilience of all employees have been challenged during this situation. Although the mental health and well-being can differ from employee to employee. Employers and HR departments can consider such things such as briefing managers on the potential mental health implications of COVID-19 and their specific roles and responsibilities in relation to supporting staff. Communication is key, for example, so for them to communicate regularly with their employees on well-being and mental health support wherever possible. Also, they could do things like providing mental health awareness and raising mental health awareness raising activities, and work towards a culture where it is acceptable to talk about and seek support for poor mental health. This is quite important because it's not always evident in the Turkish-speaking community and workplaces. But I think raising awareness and speaking about these topics is definitely a way forward to educating our community and trying to make a difference.
Yes, for sure. I mean, I'm in agreement with everything that you've said, and it's very, very important. The after effects of this pandemic have been tremendous, and especially in the NHS sector, like you said, Gulay. So yeah, very valid point. We've actually got some viewers commenting. Ergun Karpazız put hayırlı yayınlar. Kıbrıs'tan selamlar. Herkese Kıbrıs'a da biz de selam veririz. Sağ olunuz. It's great that people from Cyprus are watching our program. Abi Hussein has said, is it correct to say only mRNA vaccines are effective against Omicron variant? Who would like to answer that question?
I think between me and Sibel, we can safely say yes, can't we, Sibel?
Yeah.
Definitely. It's proven, and studies have suggested that as well, especially with the booster. So anyone over 40 who has the booster have 90% protection against the Omicron. Even though it's milder, the protection goes up a lot more, definitely. Sibel,
Yeah, exactly. And as I mentioned earlier, so the protection increases to around 70 to 75%, specifically with the mRNA booster doses, so Moderna or Pfizer. So the data does show that it's very beneficial.
Brilliant. So really good news all around. Sedpid has put Ihsan. Thank you very much for watching us and supporting us. Right, next question. What could we expect in terms of COVID next, with COVID and the vaccine? Is there a possibility of a fourth dose? Again, Mek and Sibel, I think, are the best two people to answer this. Shall we start with Mek? What do we think? Is there going to be a fourth dose coming our way?
Possibly be, but we don't know yet. We don't have the data to suggest that we need a fourth dose. At the moment, it's still early days. We're looking at the transmission between, obviously, the Omicron and the Delta. Obviously, we knew Delta was a bit more highly more invasive, and Omicron isn't. And we know as viruses emerge and come to light and they mutate, they get weaker. So although new variants will appear in the future, they don't necessarily mean they're going to get stronger and kill us. They're just there to make us sick. So basically, like the flu season, around about towards the end of the year, October, November, December, what we'll do is we'll look at new statistics from Australia. We'll get the research and we'll create a new vaccine maybe next year, this time next year actually again. So as to a fourth vaccine now, I think we don't need it personally at the moment. We've got enough boosters going around for everybody, but maybe in a year's time from now, if new variants emerge, if there is, we don't know yet. It's still early days, and I'm sure Sibel will back me up on that one as well. Sibel,
yeah, exactly. Yeah, you said it. Yeah, you said it, Mekella, in a nutshell. Also just to add that the JCVI, so the Joint Committee on Vaccination and Immunisation, said that the main aim of the vaccination campaign is to actually prevent severe disease and not prevent all infections, because otherwise we'd need an unsustainable level of repeated vaccinations. The plan is, as Mekella said, at the moment to take it a step at a time, get the data from the third boost, and then make decisions based on scientific data. But as it stands at the moment, and based on the figures, the fourth dose won't be needed because we are getting strong protection against severe disease from the boosters at the moment and our vaccination program. And again, this will be reviewed.
This is all good news. I tell you, I'm feeling very positive.
Good news.
Yeah, I do feel like it's good news because obviously, the fact is that if you're saying once you're had your booster, that's it for a good year, that's very reassuring to hear that. It means that we're, finally on top of this horrible pandemic, really, isn't it? My last question is to Didem. how to contact the TCCA to find out more about health-related services that they are providing. How can we do that?
So you can, of course, come into the centre itself and speak to someone there, either myself or Gulay. Alternatively, you can call us on 0208 826 1080, or you can email directly to us on info@tcca.org, and someone will get in touch and help you out on your inquiry.
Brilliant. Thank you very much. And that brings us to the end of our program, exactly half an hour on schedule, because we've got another program. So continue watching Eurogench TV. But yes, it's been a very informative evening tonight. Thank you very much, ladies. It's been a panel of ladies tonight, and we were talking about this backstage, girl power. I tell you, it's been brilliant. It's been an absolute privilege having you all on my program. Thank you very much. Thank you to our viewers out there. This will be on repeat on Eurogench TV if you want more information or want to hear on the particular questions. But that's it from us from Eurogench TV. I'm Aysen Djemal. A very good evening to you. Thank you.
%73% of our community have received their first dose of the COVID vaccine, and 67% have received their second. Moving forward, we still need to protect our communities and loved ones. So if you are 50 and over and eligible for the COVID booster, please attend your appointment or book online.
The coronavirus is going to be around with us for many years to come, so it's really important that we protect one another.
Over a year and a half, we have seen so many lives lost within the Turkish community. Getting vaccinated saves not only your lives, but many others.
Advances in the vaccine rollout make it possible for everybody to get protected and everyone to get vaccinated. Don't hesitate, get vaccinated, get protected.
We understand that you may have some concerns about the vaccine or require further information in order that you can make an informed decision about the vaccination process. If so, TCCA has 2 vaccination ambassadors and a number of vaccine champions. If you wish to contact us, then please do on our phone number, which is shown below.
You can book the vaccine or booster at your GP or local pharmacy. Alternatively, you will receive a text from 8450 with a link to book your booster. You can additionally find out more through the NHS website, www.nhs.uk.
If you're in full-time education and are between the ages of 12 to 15, you can get vaccinated too. I was vaccinated and I recommend it for everybody.
Aşı sizi ve çevrenizi ve toplumu hastalıktan korur. Yaşamınızın normale dönmesini kolaylaştırır. Aşı yapılmadığı zaman farkında olmadan üzerinizdeki virüsü ailenize, çevrenize ve topluma, sevdiklerinize bulaştırabilirsiniz. Aşı bütün bunları koruyabiliyor, riski azaltabiliyor. Aşı olmak hepimizin görevidir.